Okay, now here from the top, you can see the patient is centered onto the spine board. We have our strap underneath the neck area here. So what we're gonna do is wrap the strap underneath the board through the hole and lay it right below the clavicle. You don't want the metal D-ring on the patient's right side in case you have to use a defibrillator where the pads would go. So the metal D-ring should always be on the patient's left side. Lay this down. Do the same thing with the other side. The strap should come up underneath, pull it all the way through, and across the chest area to the pelvic area. For the pelvic area, you want to strap the bony part, not the soft part, which is the abdomen, right? So you touch the bony part, you go straight down and you find the holes on the backboard, and you come straight across the pelvic region right here, which is the bony part, which is the structure. You come across here and try to stay out of the camera's view here, and pull the strap through and come across to the top. Now you notice symmetry is everything. So you have this strap right here coming across, going to the outside. On this left side, you want the strap coming around to the outside. Here, you have both straps going to the inside. That's because you want this strap right here, which is holding the patient onto the backboard, close to the pelvic bone as possible. So symmetry is everything. It should look the same on both sides. This ring here will meet up, and kind of like a motorcycle helmet, if you've ever worn a motorcycle helmet, strap it through, feed it through again. And what we're going to do is a feed and pull. You don't want to yank because that's going to shift the patient, which is bad for their spinal stabilization. You hold this right here and you kind of feed it through, and then allow for some room for the patient to breathe until we're ready to move the patient. Move the strap out of the way, and we're ready to go on to the lower extremities. For the lower extremities, take this strap, unravel the strap. I always like to start with the D-ring on my side here. Okay. Outside to in, it's hard to see on the camera, but I'm going outside the board, inside. Lay it right around there in the center of the abdomen. The strap then will come all the way across the shin. I want to go outside and in. You see it's going outside the board, inside and under. Now from here, you want to go across the top of the foot, wrap it around the top of the foot on the lowest part of the foot as possible. If you have it too high, it's going to pull that foot towards the patient. You don't want that. So put it all the way to the bottom where the arch of the foot is. Come across. We're thinking about symmetry again here. So now this strap here is going inside. So now I want to go inside. So it looks the same on both sides. Right there. This is going to come across all the way to the top. And again, this is coming across here, outside to the inside, which means the strap is going outside through the hole. It's going to be nice and tight against that pelvic bone. Strap this through again. I want to use the feed and pull method again. Make sure everything is nice and snug. One more time. Now I'm ready for the head blocks. For the head blocks, make sure I start with the separated. There's 3 pieces to the head blocks. Velcro on both sides. Velcro is going to go to the bottom and towards the outside. Same thing on this side. I want to come over and place both head blocks down at the same time. That way you're not shifting the patient's head. This goes on the patient's forehead and straight down onto the forehead. At this point, I want to check extremities, PMSCs, pulse motor sensory cap refill. Just before I'm about to move the patient, I'm going to have the patient take a deep breath. Take a deep breath, sir. Tighten it up. Now I'm ready to move the patient onto the backboard.